Good morning. I'm Kay Lindblade, the Development Director for the Wisconsin Women's Health Foundation. And I bring you warm greetings from Sue Ann Thompson, who said, and these are her words, "I'm awfully sorry I can't join you this morning." So she sends you her warmest greetings. We recognize that October is Breast Cancer Awareness Month, and we acknowledge the work that you are doing, many of you are doing in this arena. We thank you for the opportunity to speak about the Wisconsin Women's Health Foundation and applaud you in your efforts on behalf of women's health. As many of you know, the Wisconsin Women's Health Foundation was founded by Sue Ann Thompson in 1997, following her own experience with breast cancer. She wanted other women to have the same experience she did, which was she had good information from which to make healthy decisions that impacted upon her health. So at the foundation, we are well aware that women make more than 80% of the health decisions for their families. So women's health is family health. Today, the foundation reaches more than 75,000 women annually through our outreach and education programs. We're dedicated to helping Wisconsin women and their families reach their healthiest potential. Our 6 focus areas are ones which disproportionately affect women. They are cardiovascular disease, cancer, mental illness, domestic abuse, osteoporosis, and tobacco. And this gives me a great opportunity to tell you what we are doing, which is producing and distributing materials statewide, providing information on radio health minutes. We're doing direct programming, training of health personnel statewide, and a license plate is just being initiated. I wanted you to see that. Projected area programs for 2007 include the delivery of Wisconsin Women's Health Guide, which is done in collaboration with Wisconsin Alliance for Women's Health. It's a statewide listing by all 72 counties of available health connections and resources, so you'll be seeing that soon. We'll be conducting the Badger Heart Program dealing with cardiovascular disease. First Breath Sites are ongoing, which is a program developing smoking cessation for pregnant women, and it's very successful. And of course, you'll hear Sue Ann's voice on the Wisconsin Women's Health Minutes. Now for some statistics, and these I think are things you would all like to know about. These are the questions I ask you. Did you know cardiovascular? Every year, 10,000 Wisconsin women die from heart disease or stroke. That means 1 of every 3 women in Wisconsin, think of us now, have cardiovascular disease, some form of cardiovascular disease. It's Wisconsin's #1 killer. Cancer. 1 out of 8 women, and think of us just gathered here, will develop breast cancer during her lifetime. Besides skin cancer, breast cancer is the most common cancer among Wisconsin women. More than 40,000 women nationwide died of breast cancer in 2005. Mental illness. Depression is the #1 cause of disability for women. Up to 25% of all women will experience depression sometime in their lives, and only 1 in 5 women with clinical depression will get the treatment they need. Just think of all the job times people don't go into their jobs because we, I say of women, are depressed. Just think of the economic factor there. Domestic abuse. Domestic violence is the leading cause of injury to women ages 15 to 44. It's more than car accidents, muggings, and rapes combined. 95% of abuse victims are women. Data indicates that a woman is beaten every 15 seconds. Osteoporosis. 8 million American women suffer from this disease, and 80% of people who have osteoporosis are women. Tobacco. Think of this, ladies. If you remember anything today besides it's Cancer Awareness Month, and we applaud your efforts, remember this: smoking is the most preventable cause of death in our state and in our country. More women die from lung cancer each year than from breast cancer, and 20% of women smoked in 2005. Just think, if anyone you know is smoking, encourage them. That would be a preventable disease, cause of death. Now, this is enough about statistics and the Wisconsin Women's Health Foundation. We all know that these statistics are really people. a family member, a loved one, a friend, or a colleague. We all know someone in this category. Each of these statistics is a real life story. Our hope is that with your help and with the help of others through our great state, we'll continue working together for a healthier Wisconsin, creating stories of health and wellness. So thank you, Dave. Thank you for your support of women's health and your awareness how it impacts on all our lives, and for the opportunity to present this information to all of you today. And remember, Sue Ann says, it all begins with a healthy woman. Thank you. And welcome.